How to understand your colon health test results. Understanding your colon health test results can feel overwhelming, but it is crucial for your health. Colon health tests, like the fecal immunochemical test and stool DNA tests such as Cologuard, are designed to detect early signs of colorectal cancer or precancerous conditions. They do this by identifying blood or abnormal DNA in your stool samples. So, how do you interpret these results? First, let's talk about normal or negative test results. If your test comes back normal, it means no blood or abnormal DNA was found in your stool. This suggests a lower likelihood of colorectal cancer or significant polyps at that moment. However, it is essential to remember that some cancers or polyps may not bleed or shed abnormal DNA consistently. Therefore, regular screening at recommended intervals is vital for maintaining colon health and catching any changes early. A negative test does not guarantee that cancer is absent, but it indicates no current detectable signs. Now, what if your test results are abnormal or positive? An abnormal result means that blood or abnormal DNA was detected in your stool. This does not automatically mean you have cancer. Many individuals with positive results do not have cancer but may have polyps or other benign causes of bleeding. Polyps can develop into cancer over many years, which is why follow-up is critical. If your test is positive, your healthcare provider will likely recommend a colonoscopy. This procedure allows for direct visualization of the colon and rectum to identify the source of bleeding or abnormal cells, such as polyps or cancer. A colonoscopy is a diagnostic test that can confirm or rule out cancer and allows for the removal of polyps during the procedure, which can reduce cancer risk. There are some important considerations to keep in mind. Do not repeat stool tests in hopes of a different result after an abnormal test. The initial positive finding requires further investigation, regardless of any subsequent stool test results. Additionally, certain foods and medications can affect some stool tests, but it is more important to complete the screening than to delay it due to dietary concerns. Screening recommendations vary based on age and risk factors. Typically, adults aged 45 to 75 should undergo regular screening. However, those with higher risk may need to start earlier or screen more frequently. In summary, understanding your colon health test results involves recognizing that a normal stool test is reassuring but not definitive. An abnormal test signals the need for further evaluation, usually through a colonoscopy, to ensure early detection and prevention of colorectal cancer. Always discuss your results and next steps with your healthcare provider to receive personalized advice based on your health status.